The Advisory Committee on Immunization Practices is meeting on September 18th and 19th. They're going to be discussing the childhood vaccine schedule and access to the hepatitis B vaccine, the polio vaccine, measles, a variety of other vaccines.
Welcome to Deep Dive. Here at the Washington Examiner, we dig deep into what's happening behind the scenes in the nation's capital. And this week we have someone who's in the trenches to give us clear insight. Washington Examiner's Gabrielle Etzel, healthcare policy reporter, has been closely watching how effective the MAHA movement has been thus far and what we should expect going forward with public health. For more, we turn to Gabrielle. Welcome to the show. Thank you so much for joining us, Gabrielle.
Thank you so much for having me, Natasha.
So let's dive right in. You've been following the developments within the CDC and HHS very closely. And so for our viewers who might be catching up, can you give us a brief overview of the key events that have unfolded recently, particularly regarding the firing of the CDC director and the growing controversy surrounding HHS Secretary Kennedy?
Absolutely. Now, it's Dr. Susan Monterez, who was appointed by President Trump this summer and confirmed by the Senate. She was fired by President Trump and Secretary Kennedy on August 27th. And the timeline surrounding her termination has been murky at best until this afternoon, until today, but when she testified before the Senate Health Committee. During her testimony, Dr. Monterez explained that her tensions started to increase between her and Secretary Kennedy in early August when media reports started indicating that Secretary Kennedy was planning on changing the childhood vaccine schedule, particularly the hepatitis B vaccine for infants. And tensions continued to increase through the tragic shooting at the CDC headquarters on August 8th, and it really culminated on August 25th. Now, Monarez said that she had 3 meetings with Secretary Kennedy that day, during which he told her that she needed to pre-approve all of the changes to the childhood vaccine schedule that the Advisory Committee on Immunization Practices, or ACIP, was going to be making later this month in September. She refused to do that without looking into the scientific evidence, she says, and that is the reason for her termination. It's been a very wild ride, to say the least.
Sure, I can only imagine. And the Make America Healthy Again Commission recently released its strategy report. What were some of the more surprising or overlooked policy proposals within that report, and what kind of impact do you think they might have?
Absolutely. There were several, well, first of all, the report, it was relatively scant. It was a report on policy recommendations and strategies based on the report that came out in May, detailing some of the science behind those problem areas that are so important to the Make America Healthy Again movement. Of those 28 policies, most reporters, most analysts focused on the call in that report to a comprehensive review of the childhood vaccine schedule, particularly, again, the hepatitis B vaccine, access to the COVID-19 vaccines, things of that nature. And then also there was a lot of attention paid to the report's call for increasing regenerative agriculture processes and decreasing the use of pesticides, which has been a significant issue for the MAHA movement. But I I was very interested in some of the more obscure policies that were in the report. First and foremost, the need to increase breastfeeding rates was received 12 lines in the, or 12 words rather, in this 20-page report. So there weren't many details, but the idea of increasing breastfeeding rates applies ties to that quote unquote crunchy mom attitude or demeanor that we see on social media frequently that kind of leans into that Maha movement. Another thing that was interesting in the report that was overlooked was the fact that the we want to the report says that the FDA needs to increase sunscreen standards. This is actually a point that Alexandria Ocasio-Cortez championed very briefly in 2023 when she said that the sunscreen standards in the United States were following behind countries in East Asia like South Korea and also the European Union. And then one more very interesting finding was the need to deregulate milk sales across state lines. Now, what that doesn't, it did not reference in the report directly the issue of raw milk or milk that hasn't been gone through the pasteurization process and hasn't been cleared of potentially harmful bacteria. But what that does refer to by deregulating milk sales and allowing small farmers to sell their milk unregulated across state lines. That's a covert reference, at least in my interpretation, to unpasteurized milk and being able to sell across state lines, which is currently illegal. Now, I asked HHS about all of these more obscure policies that haven't gotten as much attention yet, and they said that they're still in development and not being discussed at this time. But these are things to keep in mind for the rest of the Trump administration for sure.
There's also mention of Maha boxes for SNAP recipients. What's the background on this idea, and what are the potential benefits and drawbacks of such a program?
Yes, this was another interesting policy. The policy makes a reference to these MAHA boxes. Basically, the idea behind that is to give SNAP recipients direct shipments of food. So that's in social welfare terms, it's called in-kind handouts versus cash direct assistance. And essentially, the idea behind this isn't actually all that new. This was tried or proposed rather in the first Trump administration in 2018. And the promise back then was that it would reduce costs for the SNAP program, but it ultimately was met with significant pushback, particularly from advocates in the social welfare space, the boots on the ground, if you will. And it's unclear exactly since the SNAP program funding was significantly changed with the passage of the One Big Beautiful Bill Act this summer. It's unclear how they would implement such a policy.
The Trump administration is also focusing on direct-to-consumer advertising for prescription drugs. What prompted this move, and do you think it'll be effective in lowering drug prices or improving patient outcomes?
That's a really great question because direct-to-consumer advertising has been a issue for Secretary Kennedy since day one. It has been an issue for Secretary Kennedy even when he was running in his independent presidential campaign in 2024. So it's obviously a huge priority for the MAHA movement. And I was in a call with FDA Commissioner Marty McCary when that move was announced. And he expressed, again, as from his physician background at Johns Hopkins, he was expressed that doctors have been frustrated with direct-to-consumer advertising for a very long time. That commercials for these so-called wonder drugs or these drugs that make themselves appear as wonder drugs really interfere with the doctor-patient relationship, and it makes it difficult for doctors to communicate directly with their patients about what's best for their needs. So there's a very big push from the administration to get this done. And Commissioner McCary also expressed that the goal would be for pharmaceutical companies to use the money that they spend on advertising, which sometimes can be up to half of their budgets, more than they spend on research and development, to use that money to lower drug costs on the front end for patients. But it's not really clear right now whether or not this type of policy is going to stick. There's been a lot of pushback in terms of the courts on this issue in the past because of First Amendment free speech jurisprudence in terms of advertising, and it's just unclear whether or not it's gonna move forward.
Given the significant spending on advertising by pharmaceutical companies, do you see this as a real challenge to the industry's practices?
It would be a challenge for certain companies, most definitely. But at the same time, again, Commissioner McCary, on the day that this was announced, told reporters that he had spoken with several pharmaceutical companies. He wouldn't name names, unfortunately, but he spoke with several pharmaceutical companies who expressed that they would welcome more regulation on direct-to-consumer advertising and to be able to rein in the practice a little bit more. So there's potential, and that's working in collaboration with industry seems to be a major strategy for the MAHA movement in general, whether that's food additives or other things of that nature, seed oils. The ability to communicate from government to industry and work together on change seems to be a major strategy. So maybe we'll see something like along those lines in the future.
The long-awaited autism report from HHS Secretary Kennedy is expected soon. There has already been significant market reaction to reports linking Tylenol to autism. So what's the current understanding of the science behind this potential link, and how might this report impact public perception and future research?
It's a very important question, Natasha, because the research is very unclear. To be honest, acetaminophen, the active ingredient in Tylenol and certain other over-the-counter pain medications, thinking like NyQuil, Dayquil, things of that nature, is such a ubiquitous ingredient in so many different products. But it's really difficult because most of the studies that have been conducted on acetaminophen are relational studies. So it's that there's some sort of relationship, there's some sort of correlation with acetaminophen and autism, but there's no causation. There's nothing that has been proven as a causal direct link, and it's very difficult, if not impossible, to really to make that causation distinction there, especially when we're talking about very vulnerable human research projects. I've also seen things that suggest, I've seen experts talking about that it could be the connection between that, or that relational connection rather, between acetaminophen use during pregnancy and an autism diagnosis could be from the high fever that the mother had that caused her to take the acetaminophen in the first place. So bottom line, there are a lot of intervening factors here, and especially when we're dealing with something as serious with this, every patient needs to speak with their physician whenever taking over-the-counter drugs, but especially during pregnancy.
How much influence is RFK Jr. actually wielding within the HHS, and how is it affecting the morale of staffers? We saw that over 1,000 HHS staffers have called for his resignation.
It's very difficult to see, to be frank, what's going on right now at HHS. It's in some respects a little bit of a black box. It's a difficult time, I know, for a lot of people on the ground at HHS, or at least that's what has been reported. What Dr. Monarez and her colleague, the former chief medical officer at CDC, Deb Howery, said during their Senate testimony today is that Secretary Kennedy was, as particularly at CDC, taking more political control over the agency, not taking advice and meetings with career science staff. staff. And I've asked HHS about some of these issues, and they haven't responded to requests for comment yet. But you can tell that Secretary Kennedy and his staff are taking a very heavy hand in definitely at CDC, but also in other branches at HHS as well.
Do you think his stance on vaccines is influencing policy decisions in a way that concerns public health experts?
It definitely concerns public health experts, Natasha. We're seeing where we saw former Surgeon General Jerome Adams write about the COVID vaccines over the weekend. We've seen the American Medical Association has been calling for Secretary Kennedy to resign for weeks. We've also seen the American Academy of Pediatrics issue its own independent recommendations. We've also seen the American College of Cardiologists also make their own vaccine recommendations. So bottom line, we're seeing professional organizations as well as outside scientists and outside medical professionals very concerned about some of Kennedy's recommendations.
We're seeing some states, particularly on the West Coast and in the Northeast, forming coalitions to create their own vaccine recommendations, seemingly in response to the changes at the CDC. So, what does this say about the level of trust in the CDC right now?
Well, Natasha, I think that it shows that there's a significant amount of political polarization that's going on with respect to trust in the CDC. We've seen data in the past in the past couple months, that Republicans are actually increasing their trust in the CDC, increased by 10 points, percentage points, since Secretary Kennedy has taken office, and Democrats are declining in their trust of the CDC since Kennedy took office. So there's been a little bit of a shift there. But as far as trust in the CDC goes, we have to keep in mind that trust in the CDC was eroded significantly during the COVID-19 pandemic. It was brought up in Dr. Manara's hearing this afternoon that the CDC was former director Rochelle Walensky was coordinating with teachers unions to keep lockdown measures in place to prevent kids from going back to school. And so between that and the revelations that came out last year about mask mandates not necessarily being backed by science, and social distancing, and the rest of it that we lived through 5 years ago, there has been a rapid decline in trust for several years. And so what we're seeing is liberal states, Hawaii, Oregon, California, Washington, and then the 9 New England and Mid-Atlantic states, they're making their own recommendations and their own public policy decisions with respect to the COVID, flu, RSV vaccines. And we'll see whether or not there's going to just be a greater level of fractionalization on vaccine policy going forward.
The fired CDC director, Susan Monterez, testified before the Senate today, which you mentioned. Were you surprised when she was asked about her attorney's anti-Trump stance? Is this something that has come up before?
No, I haven't seen this before. It was very interesting when it was first brought up, and I unfortunately wasn't in the room to see. But Senator Moody referenced that her attorneys were passing notes back and forth during the testimony, which is rather common between attorneys and their clients. So it was a very interesting perspective. What was interesting too is that they were very concerned with the timeline at which she hired her attorneys. Now, again, if we go based upon her testimony, she had very confrontational discussions with Secretary Kennedy on the 25th, and then was ultimately fired on the 27th. And so she during her testimony did not say, or could not say, exactly when she retained counsel. But I can imagine that during those kind of tumultuous days leading up to the culminating event that we saw publicly, that were a lot of moving pieces, and I can, from a personal perspective, understand why she might not have the times exactly right.
And finally, looking ahead, what are the key developments you'll be following in the coming weeks and months regarding the MAHA initiative and the future of public health in America?
That's, oh my goodness. It's an absolute blessing to be able to follow all of this. What I'm going to be watching closely for, the Advisory Committee on Immunization Practices is meeting on September 18th and 19th. They're going to be discussing the childhood vaccine schedule and access to the hepatitis B vaccine, the polio vaccine, measles, a variety of other vaccines. And so that will be something very important to watch. We're also looking very much forward to the autism report, as we discussed earlier. Secretary Kennedy this spring said we would find the causes of autism spectrum disorder by September. And so that report is expected sometime this month. I'm also going to be watching for several things with respect to abortion and IVF access. Access to IVF, I should say. The President Trump promised this spring that his domestic policy council would be looking into ways to make IVF more affordable for parents, including mandating insurance coverage and of the procedures. And that was that the deadline he set for that is come and gone. So hopefully we'll be getting some news on that sometime soon as well.
Well, health is such an important aspect in all of our lives. So, Gabrielle, of course, we thank you for keeping a close eye on this and have really enjoyed your thorough reporting on the topic. And of course, we're looking forward to your future articles. Thank you so much.
Thank you so much, Natasha.
Well, thank you so much for watching Deep Dive. Please visit our website for more of these investigations and feel free to send us your questions or story ideas. We hope to see you back here next week.